Welcome to Stroke Awareness, presented to you by Kaiser Permanente Santa Clara Medical Center. Did you know that stroke is the third leading cause of death in the United States? Every 53 seconds, someone has a stroke, but the good news is that it is preventable. By making the right healthy lifestyle choices and working with your doctor to treat any risk factors, strokes can be prevented. I'm Dr. Cho, the Director of Stroke Program at Kaiser Permanente Santa Clara Medical Center. We have been certified as a primary stroke center by the Joint Commission since 2004. We're proud to have been one of the first hospitals in the state of California to obtain this certification. Our goals for this presentation are to define what stroke and TIA are, to explain what the risk factors contributing to stroke are, to review lifestyle choices that may help you prevent having a stroke, identify the signs and symptoms of stroke, and to finish by summarizing the key messages for you. Let's get started. A stroke happens when blood flow to a part of the brain stops. It is sometimes called a brain attack. If blood flow is stopped for too long, the brain cannot get oxygen and the nutrients it needs. The brain cells can suffer permanent damage and may die. The actual symptoms of stroke depend on what areas of the brain are involved. There is also a condition called TIA. This is short for transient ischemic attack. It is sometimes called the warning sign of a stroke or a mini stroke. A TIA is a brief interruption of the blood supply to a part of the brain that causes a temporary impairment. Depending on the area of the brain involved, it may affect vision, speech, or movement. It usually lasts less than an hour. Often, it is just 5 to 10 minutes. While the symptoms go away quickly, it should not be ignored. A TIA is as serious as a stroke because it is usually a warning sign of impending stroke. The person is now at an increased risk for stroke. There are two types of stroke, ischemic stroke and hemorrhagic stroke. In an ischemic stroke, a blood clot either travels or develops within the blood vessel and blocks the blood flow, which then leads to damage of that area of the brain. In a hemorrhagic stroke, there is a rupture of the blood vessel inside the brain that causes bleeding inside. Unfortunately, both types of stroke can cause brain cells to die and may cause a person to lose control of their speech, movement, and memory. This is a CT scan of a person who had an ischemic stroke in the past. The area inside the red dotted box shows the area that was affected by the stroke. Sometimes a blockage develops within the blood vessel. For example, fat and cholesterol can gum up the walls of the blood vessels and cause blockage. That is called atherosclerosis. Sometimes the clot can break off from elsewhere in the body and becomes lodged in the blood vessel in the brain, blocking the blood flow. This is called embolic stroke. For example, in atrial fibrillation, clot comes from the heart, goes to the brain, causing a stroke. Here is a CT scan of a hemorrhagic stroke. It resulted from a weakened blood vessel that ruptured and bled into the surrounding brain tissue. Untreated high blood pressure is one major cause of weakened blood vessels leading to bleeding in the brain. Another example of hemorrhagic stroke is from a ruptured aneurysm. Now, anyone can have a stroke, but the chances of having a stroke increase if a person has certain risk factors or medical conditions that are associated with having a stroke. The best way to protect yourself from stroke is to understand your own personal risk. Risk factors can be put into two categories, controllable and uncontrollable. Let's first introduce uncontrollable factors. These are risk factors that increase the risk for having stroke that unfortunately we're not able to change. Age. Stroke risk increases with age. For every 10 years after the age of 55, the risk of stroke doubles. And 2/3 of all strokes occur in people over 65 years of age. Family history. Stroke seems to run in some families, especially in families with strong history of high blood pressure and diabetes. Race. African Americans are twice as likely to die from stroke than Caucasians. Hispanics and Asian Pacific Islanders are also at increased risk of stroke compared to Caucasians. Gender. Women suffer more strokes than men, but most of that is probably due to the fact that women live longer and stroke is much more common when you're older. And lastly, if you had a stroke or TIA, your risk of having another one goes up. The good news is that there are controllable risk factors. These are risk factors we have the capacity to control, manage, or change. The most important one is high blood pressure. High blood pressure is called the silent killer because many people don't know that they have high blood pressure. Even when they know they have high blood pressure, it is often not under control. High blood pressure in the meantime is causing atherosclerosis, blocking the blood vessels, damaging and weakening the blood vessels. Even if high blood pressure is not making you feel bad now, it's causing damage to the blood vessels, to heart and kidneys. Remember, high blood pressure is called silent killer, and it is the number one cause of stroke. Other causes include atrial fibrillation, diabetes, and carotid artery disease. These are all medical conditions that once diagnosed should be managed and controlled. Lastly, we know that making healthy lifestyle choices will lower your risk for a stroke in the future. This includes maintaining a healthy weight, not smoking, reducing high-fat foods, and limiting alcohol intake. Let's discuss the factors you can control, since your actions can directly reduce your risk for stroke. High blood pressure is a serious condition that can lead to stroke as well as coronary artery disease, heart failure, kidney failure, and other health problems. It is important for you to know your number. Know your blood pressure. As I said earlier, many people don't even know that they have high blood pressure. Remember, it is a silent killer. We suggest having your blood pressure checked every 1 to 2 years. Blood pressure is measured as a systolic and diastolic pressure. The top number, systolic, refers to blood pressure when blood is pumped away from your heart. The bottom number, diastolic, refers to blood pressure when the heart is at rest, filling up with blood. Normal blood pressure is 120/80. Hypertension is defined as greater than 140 systolic over 90 diastolic. High blood pressure, hypertension, put you at risk for having strokes and heart attacks. If you have high blood pressure, your doctor may prescribe medications to lower it. If you stop taking your medicine, the blood pressure will go back high, and over time, it will damage the body in many ways. When we talk to patients about their blood pressure medications, we often find that people stop taking the medications over time. We hear our patients say, "My blood pressure goes up only when I come to see you." "My blood pressure medication is too expensive." Or, "I'm a walking pharmacy. I'm already on too many medications." These are all legitimate concerns. But if uncontrolled, your high blood pressure can cause strokes and heart attacks. If you do not take the medications as prescribed, your blood pressure will stay high. The medications must be taken as prescribed to lower your blood pressure. Remember, the higher the blood pressure, the greater the risk of stroke. We know medications work. You should follow your doctor's orders and begin medication as soon as possible. If you lower your blood pressure even by a small amount, you are lowering your risk of stroke significantly. For example, let's say I lower my blood pressure from 150 to 140 by following my doctor's recommendations. I will reduce my risk of stroke by 30%. That's huge. More than 2 out of 3 people over age 65 have high blood pressure, but only 40% of people with high blood pressure have it under control. and it is not uncommon to need 2 or 3 different medications to control blood pressure. Now let's talk about atrial fibrillation. Atrial fibrillation is an irregular beating of the heart. Some people know that their heart is irregular and describe palpitations, others don't. Not all palpitations are from atrial fibrillation. It's common to have skip beats or extra beats here and there. Atrial fibrillation is a particular type of irregular heartbeat. When atrial fibrillation occurs, the top left chamber of your heart, called left atrium, starts to beat fast and very irregularly. One person I know describes it as my heart playing jazz. It's a chaotic rhythm. This results in the formation of blood clots. If a clot leaves the heart and travels to the brain, it can cause blockage of blood flow to the brain and cause a stroke. As you get older, you are more likely to develop atrial fibrillation. It causes 1 in 4 strokes of all strokes occurring in people over 80 years of age. The good news is that there is a medication for it. A blood thinning medication can lower the risk of stroke from atrial fibrillation by 60 to 80%. Having diabetes increases the risk of stroke as well. If you don't have diabetes, the best prevention is to eat a balanced diet, stay healthy, stay active, and maintain a healthy weight. If you have diabetes, you're at risk of having a stroke at an earlier age than other people. What can you do to lower that risk? Keep your sugar down. Hemoglobin A1C is a special blood test. It tells you how good your sugar has been in the last 120 days. The goal is to keep hemoglobin A1C lower than 7. It's important to get checked for diabetes because about 2% of the population who have diabetes don't know that they have it. The carotid arteries are 2 large blood vessels located in the front of the neck, and they supply the blood to the brain. There are 2 smaller arteries in the back of the neck called vertebral arteries. High blood pressure, high cholesterol, diabetes, and smoking can all cause a fatty, sticky substance called plaque that builds up inside the blood vessel walls. And over time, plaque becomes hard and more plaque develops over it, and gradually the artery becomes narrowed and not as much blood can flow to the brain. Sometimes the artery can get extremely narrowed and it can also develop clots within it. When carotid arteries are severely blocked, the risk of stroke becomes very high, and sometimes you will have warning signs, TIAs that we talked about earlier. A surgeon can go and clean out the carotid artery, as in a roto-rooter job. This surgery is called carotid endarterectomy. Carotid artery blockages can also be stented to open up and let more blood flow to the brain. Preventing a stroke is a much better strategy than treating one. Let's discuss what else you can do to lower the risk of stroke. The lifestyle choices you make and the actions you take can make a big difference. Healthy eating. Eating a balanced diet and in moderation will help manage weight, lower bad cholesterol, lower high blood pressure, and manage or prevent diabetes. Physical activity. Consistent exercise will also help you manage your weight, increase the good cholesterol, lower your blood pressure, and manage or prevent diabetes. And lastly, partner with your medical provider. Consult your doctor regularly, as he or she is your best resource. Follow their recommendations. Take your medications as prescribed, and keep your appointment for annual checkups and exams. Please visit your doctor's Kaiser Permanente homepage to find valuable resources on most of your healthcare needs. For example, if you smoke, we encourage you to quit. Smoking and secondhand smoke exposure both increase the risk of stroke. And we know it's not easy to quit. Your doctor's homepage has the tools you need. Find out how we can help you quit once and for all. A well-balanced diet is an important factor in stroke prevention. Eating too much of the wrong things puts us at risk of excess weight, high cholesterol, and high blood pressure, to name a few. Eating plenty of whole grains, vegetables, and fruit to increase dietary fiber is important. Reduce salt intake to no more than 2,400 milligrams a day. We recommend drinking 8 glasses of water a day and limiting your alcohol intake to less than 1 drink a day for women and less than 2 drinks a day for men. We mentioned it is important to choose foods low in fat. However, it's a bit more complicated than that. Fat is actually a necessary part of a healthy eating plan. Fat plays many important roles in your body. It supplies your body with energy and essential fatty acids. It is important in absorbing certain vitamins. Your body uses fat as important building blocks in many body structures and chemicals. The key to healthier eating is to choose foods with good fats that help protect your heart and reduce your risk for stroke. And the key word is moderation. A moderate amount of fat means no more than 25 to 35% of your total daily calories should come from fat. As shown here, foods high in monosaturated and polyunsaturated fats are recommended. These fats help to raise your good cholesterol, HDL. Olive oils, canola and peanut oils, safflower oil, corn oil, as well as avocados, soybeans, and an array of nuts are good for you when combined with fiber-rich whole grains. In addition, omega-3s are an important polyunsaturated fat. These are found in fish oils and some plant sources. They help to reduce inflammation inside your blood vessels, which slows plaque buildup in the arteries. On the other hand, eating foods with a lot of saturated fats, trans fats, and cholesterol can raise the LDL, the bad cholesterol, and triglyceride levels in your blood. Having high levels of LDL and triglycerides put you at a greater risk for stroke. So we ask you to avoid processed foods and whole milk products, since these have a lot of saturated fats, trans fats, and cholesterol, the bad fats. In addition to healthy eating, being physically active will help lower your risk for stroke. For most people, the hardest part of exercising is just getting started. Hectic schedules with work and family make it difficult to find time for exercise. Some people may also feel confused about what type of exercise to do or how much. They might feel intimidated about starting an exercise quote-unquote program. An easy way to start is to use the FIT principle, F-I-T-T. This acronym stands for frequency, intensity, time, and type. Frequency. How often should you exercise? Determining the frequency of exercise is important in order to find the balance that provides just enough stress for the body to adapt and yet allows enough rest time for healing. Intensity. How hard should you exercise? It should be hard enough to stress the body, but not so difficult that it causes injury or burnout. Time. How long should you exercise? This will vary based on the intensity and type. The recommendation is 30 to 60 minutes on most days of the week. Type. What type of exercise should you do? Cardiovascular or aerobic exercise will make your heart stronger and help you develop stronger muscles and bones. Here's an example of FIT. I will walk, that's type, at 4 miles per hour, that's intensity, for 45 minutes, time, 4 times a week, frequency. Making this small action plan will keep you focused, challenged, and committed to your goal. The most important thing to remember, though, is that some is better than none. We have been talking about how stroke is preventable by making healthy lifestyle choices and by following your doctor's recommendations. You can reduce your risk of having a stroke. Now let's move on and talk about how stroke is treatable. You will learn life-saving tips on how to recognize signs of stroke and what to do if you or someone around you is experiencing them. The key word here are sudden symptoms. Warning signs of stroke usually occur suddenly. If you suddenly become weak or numb on one side of the body, or have difficulty speaking or walking, feel clumsy, lose balance, you may be having a stroke. Here's a quick and easy way to remember how to recognize a stroke and what to do if it happens to you or someone you know. Just remember the word FAST, as recommended by the National Stroke Association. Each letter in FAST stands for face, arm, speech, and time. Face. Smile, or ask the person to smile. Does one side of the face droop? Arm. Raise both arms. Does one arm drip downward? Speech. Repeat a simple sentence. For example, it's a sunny day. Are words slurred? Can you understand what the person is saying? Can the person repeat the sentence correctly? Lastly, time. If someone is having a stroke, time is critical. Call 911 immediately. Calling 911 cannot be overemphasized as it will initiate a stroke alert. Paramedics will arrive and ask you vital questions, such as when the symptoms started. They will bring you to the emergency room where doctors will determine if you are a candidate for clot-busting medications or surgery. This could save your life. If the emergency room doctor determines that you're having an ischemic type of stroke, you may be eligible for a clot-busting medication called tissue plasminogen activator, TPA. It needs to be given within 3 hours, and in some cases up to 4.5 hours from when you were last well. So knowing exactly when your symptoms started is very important. When were you last well? The earlier you receive the clot-busting medication, TPA, the more likely you'll recover from your stroke. Remember, time lost is brain lost. If you or someone near you is experiencing symptoms of stroke, it is an emergency. Call 911. In summary, I would like you to remember that strokes are preventable and treatable. To reduce your risk of stroke, eat healthy, exercise, stop smoking, and limit your alcohol and salt intake. Ask your doctor if you have high blood pressure or diabetes. Know your numbers for blood pressure, sugar levels, and cholesterol. See your doctor for regular checkups and follow his advice. If your doctor prescribes medications to treat high blood pressure or high cholesterol, remember to take the medications as prescribed by your doctor. It can save your life. Partner with your medical provider. You and your doctor can work together to prevent and treat the medical conditions that can lead to stroke. Discuss your treatment plan regularly and bring a list of questions to your appointment. Finally, don't forget FAST. Face, arm, speech, and time. Recognize the warning signs and don't hesitate to call 911 if you think you're having a stroke. Early medical evaluation and treatment can decrease your risk of long-term disability and even save your life. If you have any questions or would like more information about stroke awareness, visit us at www.kp.org/mydoctor to get started. We're here to help.